for keeping your tube clean and doing all the maintenance on your tube. So remember I said that here's the body wall, this goes inside the stomach, and this comes outside. I want you to check this outside every single day to make sure that there's no swelling, no redness, no bleeding, no pus, like yellow, thick, sticky, white-ish discharge, and no smell, because the first indication that you've got a peg tube infection is going to be like that thick discharge and the smell that comes with it, okay? So we're gonna check this area and make sure that we don't have any grossness, anything that's concerning, and then we're gonna want to clean it. And in order to clean it, we'll take gauze, or you can use just a soft cloth at home and get some warm water on it. I'm gonna do that right now. And then you're gonna wipe this area where the skin's coming through with your warm water. Please do not use any soap, because using soap can irritate the skin and it can cause, actually cause infections and issues. So we don't wanna do that. So once we've wiped it down with our warm water, we're going to take a dry cloth and we're gonna dry the same area. You're also going to make sure that you're looking here at these sutures and that all of them are intact. If there's an animal that's not really pulling at their tube, they're not really getting it caught on things, it's okay if they lose one suture. But if they start to lose more than that, or if they're the type of animal that's going to get this caught or is gonna tug at it, just make sure that you let us know if a suture is missing, and that way we can put them back in, okay? So for this area right here, where the skin is, you're gonna make sure as well that the skin is not swelling and pushing through here. Kind of trying to make my finger do it, it's kind of hard to see. But if the skin is pushing and swelling through here, you need to let us know that as well, because that can indicate that this might be a little bit too tight. We might have to adjust it a little bit. So no big deal there. So this tube also has an area that comes apart. I'm gonna try to prise it open here a little bit. And so if you have a tube that gets really, really, really gross, and the technicians or the doctor instructs you to do so, we can also pull this back just a little bit to clean inside here. You'll make sure that you check exactly what number your tube is at and where. So this right here is at 3.5. So that way when we pull this up a little bit to clean underneath it, that we know right where we're going to put our tube back, because that's very important. The tube can't go too far in, especially within the first couple of weeks after it being placed. It can cause a lot of issues that become an emergency. So you want to clean through here, you can clean in here, you can use Q-tips, and if it gets dirty in here, you can clean in here as well. And then you just make sure that you're back at your number right where you need it to be. Put it back in and close it back up. And if you find that your tube is getting really, really gross, you're cleaning it once a day, we're getting a lot of discharge on here, and it's not like swollen, red, pussy, foul smelling, then we can have you do it more than once a day. So cleaning it 2 to 3 times a day is totally fine as well. If it needs it. I don't want you to over clean the area for sure, so it's not irritating the skin. And just as a side note, a slight brownish discharge, like a tannish kind of color discharge, is completely normal for this. It should be thin and watery. Sometimes if it builds up a little bit, it'll create like a little brown crust, which of course we don't want on there. We want to clean it off, which is why we have you cleaning it every day, but it is normal to have that little bit of discharge. And I do have a picture here. It's kind of hard to see, but I do have a picture of what the tube looks like up against a dog's skin with all of its sutures intact. And then down here, you can kind of see the little bit of crust that has built up because this tube wasn't cleaned as much. And so we got all of that off, cleaned it up, and everything was fine. All right, let me set this over here. And then I'm gonna pull our little doggy friend over. And so the tube, when it's in, comes out the left side of the body. So I'm gonna pull this dog's little t-shirt up and kind of put this tube where it should be. So the tube's usually around this area on the left side of the body. And the tube comes up and over the back like this. And I made this one a little bit extra long for this little puppers. And then the shirt will go over this. We at Vet Specialty usually have a double shirt, and I'll show you what that means in a second, that helps us to keep the tube secure and where everything's supposed to be so that it's not, number one, flopping all over the place and getting potentially caught in anything. And then two, it also helps keep from the pet being scared, because we have had some animals who their tube has come out and then they freak out because they think something's chasing them. And we definitely don't want that. So here's the shirt with the tube in it. And so it's double layered. So you pull up the first layer and you can see there's a hole right here that the tube underneath has coiled around and been brought up through this hole. This will also allow you to do the feedings from here so that you don't have to pull the shirt all the way up if you don't need to. And this also keeps this bottom part of the tube nice and tucked in. And then we've got the second layer that goes up and over, and that just completely secures that tube up against the body so it's not moving, not coming loose, not causing a problem. Some people do like to buy little doggy shirts from like PetSmart or something for their pet. So the same thing would kind of apply. Obviously their little legs go in here. The tube would come out and coil around. And then what people will usually do is get like a binder clip or like one of those hair clips, and will hold the tube just like this. A lot of people will also buy baby onesies. So just like this, same thing applies. Tube goes underneath, comes up here, and then we put either a hair clip or a binder clip here to secure the tube to make sure it's not falling out and flopping around. Also, this way you can just decorate your animal and they don't have a choice and they have to look cute. So, all right, so let me pull my little doggy friend back over here. So for the shirts that we give you, and obviously the same for any shirt that you might buy, they do get dirty with the animal's movement, animal's play, getting food on it, especially if you're just lifting up the first layer and feeding through the shirt, and with any discharge that might be coming from the tube itself. And so you're gonna want to make sure that you're keeping these t-shirts clean. So if you notice some soil on it, for our shirts, I want you to wash these by hand. We usually give you 2 shirts to go home with so that they can be changed out. So you'll be put the new one on and you'll be washing the other one at the same time. Wash it by hand and hang it up to dry. For our shirts, if you pop them in the washer or dryer, it will destroy the shirts prematurely, so I don't want you doing that. For the baby shirts and the dog shirts, they're usually okay going in washer or dryer, but again, make sure that you have a second one to put on your pet while we are cleaning the first one, okay? Time that you have a peg tube discharge from our hospital, you will get this peg tube care information sheet. We are going to also put it on our website, so please feel free to refer to this for cleaning issues. We also will have a sheet that goes with you that gives you the amount of food that you need to be feeding, how often, and for how long. There are a bunch of frequently asked questions that we also have on our discharges. It's a little bit too much to go into for this talk, but we do have it on our website and we also have it on our discharges. So if you guys ever have any questions, we're here 24 hours a day. Please feel free to give us a call. Take care.